Imagine waking up one morning and suddenly, your hearing is significantly diminished in one ear. Sounds become muffled, distant, or simply disappear altogether. This is the reality of sudden sensorineural hearing loss, or SL, a medical emergency affecting thousands each year. This video will explore this condition in detail, covering its causes, symptoms, diagnosis, treatment, and more. Pinpointing the exact cause of SSNHL is often challenging. In the vast majority of cases, it's idiopathic, meaning the origin remains unknown. However, several factors are suspected to play a role. These include viral infections such as mumps, measles, or herpes simplex virus. Vascular problems, such as a blood clot or hemorrhage affecting the inner ear, can also be responsible. Autoimmune diseases like lupus or rheumatoid arthritis, acoustic neuroma, head trauma, and certain medications are other potential culprits. In some rare instances, SSL can be linked to specific neurological conditions. While the precise mechanisms aren't fully understood, the pathophysiology of SSNHL likely involves damage to the delicate structures of the inner ear, specifically the cochlea. This damage affects the sensory hair cells, which are responsible for converting sound vibrations into electrical signals that the brain interprets as sound. Inflammation, reduced blood flow to the inner ear, or direct viral invasion can all contribute to the dysfunction or death of these hair cells, leading to a sudden and significant loss of hearing. SSNHL affects an estimated 5 to 27 people per 100,000 annually. It can occur at any age, but it's most commonly seen in adults between the ages of 30 and 60. Both men and women are affected equally. While it's considered relatively rare, the true incidence may be higher, as some cases might go unreported or misdiagnosed. The most prominent symptom of SSNHL is a rapid and unexplained loss of hearing, usually affecting only one ear. This loss often occurs over a period of hours or days. Accompanying symptoms can include tinnitus, a ringing, buzzing, or hissing sound in the ear, dizziness or vertigo, a sensation of spinning or imbalance, and a feeling of fullness or pressure in the affected ear. Some individuals may also experience sensitivity to loud noises. Diagnosing SSNHL typically involves a thorough medical history, a physical examination, and audiologic testing. A hearing test, also known as an audiogram, is crucial to confirm the presence and severity of hearing loss. This test helps determine whether the hearing loss is sensorineural, meaning it originates in the inner ear or auditory nerve. Other tests, such as speech discrimination testing, can assess the ability to understand spoken words. An MRI may be ordered to rule out other potential causes, such as acoustic neuroma or other structural abnormalities. While SSNL is generally classified as sudden onset hearing loss in one ear, some classifications consider the degree of hearing loss. It can be described as mild, moderate, severe, or profound, based on the decibel level at which sounds can no longer be heard. Another factor is the shape of the hearing loss on the audiogram. Flat, sloping, or rising configurations may be noted. However, these classifications primarily help characterize the severity of the hearing loss rather than indicating distinct types of the condition itself. The primary treatment for SSNHL is corticosteroids, either in pill form or injected directly into the middle ear. These medications help reduce inflammation and swelling in the inner ear, potentially improving blood flow and promoting recovery of damaged hair cells. The earlier treatment is started, the better the chances of recovery. Other treatments may include antiviral medications if a viral infection is suspected, or vasodilators to improve blood flow to the inner ear. In cases where hearing doesn't recover, hearing aids or cochlear implants can be considered to improve hearing function. Currently, there's no definitive way to prevent SSNHL, given that the cause is often unknown. However, maintaining a healthy lifestyle, including regular exercise, a balanced diet, and avoiding smoking, may help reduce the risk of vascular problems and other health conditions that could contribute to the development of SSNHL. Prompt treatment of ear infections and avoiding exposure to loud noises can also help protect hearing. The prognosis for SSNHL varies significantly from person to person. Approximately 1/3 of individuals experience spontaneous recovery, meaning their hearing returns to normal without treatment. Another third may have partial recovery, with some improvement in hearing. Unfortunately, the remaining third may experience permanent hearing loss. Factors that can influence the prognosis include the severity of hearing loss, the time between onset and treatment, the patient's age, and the presence of other medical conditions. Recent research is exploring new treatment options, including regenerative therapies aimed at restoring damaged hair cells and targeted drug delivery methods to enhance the effectiveness of medications.